Good afternoon, everyone. Welcome. It's time, or almost time, for our July Partner Learning webinar. We know folks are just logging on and getting settled, so we're going to start, in about 2 or 3 minutes. I know Tavish has been chatting out messages to all of you, and we'll be back in just a couple minutes, and we look forward to getting started. Thanks. Hello, good afternoon, and welcome to HealthierHere's July Partner Learning webinar. I'm Mary Megliola-Franzen. I'm a Practice Transformation Manager here at HealthierHere, and I'm sitting in a room with Tavish Donahue. Hello, everyone. Tavish is a Senior Practice Transformation Manager. This month's topic is the Washington Overdose Notification System, the Overdose Letter Notifications. A quick word about that. That is a notification system where notifications go out to a primary care provider or another prescribing caregiver, and the notification goes out if one of your patients is in the hospital emergency department and is confirmed to have experienced an overdose event. It uses the existing EDI platform, Emergency Department Information Exchange platform, that I know a lot of folks are very familiar with, and the system is in place in several counties around Washington with the goal of helping clinicians, giving them meaningful information to help stop overdose deaths in Washington State. We have some folks from Collective Medical who will be making the presentation today. But before we get started, a couple housekeeping items. Tavish is going to be monitoring chat throughout the presentation. And that little orange arrow over there in this picture, let's see if I can point to it, right there, is how you expand and collapse the box on your screen, and you can chat in your questions. Tavish will be answering as we go along. Or if it's a question that we're not quite sure of the answer to, we'll hold the question for our presenter. She's going to pause at one point in her presentation to take the questions out of chat. So if you don't get an answer right away, sit tight and we'll be presenting the question later. Also, if you prefer to speak your question, there's a way to raise your hand, and you have to have your audio pin enabled. You have to have called us on the phone, and there's a little hand icon in that ribbon for raising your hand to speak. And if you do want to speak your question, we can unmute you and ask the question that way. So before we get started, we have a couple of polls, real quick polls we want to ask, just to get an idea of who's on the phone with us today. We know we have folks from King County and other counties, and even some folks outside the state. So the first question is, Tavish is opening the poll.
Yeah, and the answers are coming in now.
Oh, okay. I don't see it on my screen, but apparently other people see it. Is what kind of organization are you part of?
Yeah, and we're going to give you another minute or so to submit your responses, and then we'll share the results and we'll read through them.
Okay, sounds good. So we'll just pause for a moment while we find out where everyone's coming from. All right, what do we got?
Okay. Bear with us a moment. We're going to share this out, so it will pop up on your screens. Okay, so we've got 17% of our attendees are from hospital systems, 10% are from federally qualified health centers, F2HCs, 15% are from BHAs, our behavioral health partners, 8% of you are from community-based organizations, and then we've got 49% other.
Oh, okay. And then we have a second poll question for you that Tavish is launching about your role in the organization.
And this is very important information for our presenters. So thank you so much for
we appreciate you taking the time.
Okay, and we'll leave this open for a minute or two so you can submit your responses. We're asking for your role or your organization. The choices are prescribing provider, clinic manager or administrator, nurse care manager, social worker or therapist, or other.
Okay, can we share this?
Yes.
Okay.
Okay. We've got about 90% of you have submitted your responses. Thank you so much, and we are going to share out that information. Okay, so 6% of you are prescribing providers, 14% are clinic managers or administrators, 9% of you are nurse care managers, 9% again as social workers or therapists, and then 62% are other.
Okay. Well, thank you all very much. It's very helpful to know who's joining us today, and we're glad you all can make it. And now I'm going to, in a moment, turn this over to our presenters. We have two folks presenting today. One is Rachel Lieber, who is Collective Medical, and also Danielle Siniskalki, both of Collective Medical. And I'm going to turn it over to Rachel. She'll be controlling the slides, and also let her introduce the Collective Medical folks to you.
Thank you so much. Good afternoon, everyone. My name is Rachel Lieber. I am the General Manager for Collective Medical's Pacific Northwest market. I'm going to go ahead and show my screen here. We should be in good shape. Okay. I have the pleasure of working for Collective Medical and working with all of our customers and partners across Oregon, Washington, and Alaska. With me today is also Danielle Siniskalki, who is one of our directors of product and has worked very closely on this initiative and is a partner of mine as we advance this work across the state of Washington. So I have spoken with many of you on the phone. I had a chance to look over the attendee sign-up list. It's nice to reconnect with many of you and also build some new relationships. Collective Medical, we are the service provider that helps move the notifications to prescribing providers around the state of Washington. As the folks from HealthierHere mentioned, this is associated with House Bill 1427. And we have been going from pilot phase into statewide rollout for about the last 8 months. So we're excited to see the folks from HealthierHere and other prescribing providers opt into this notification and grow the network. So we all know that overdose deaths in Washington is a problem, and we need to leverage technology and event notifications to try and bring meaningful information, stop opioid deaths, overdose deaths, and use information and other training tools to give prescribing providers alternative options. We are excited to be a partner in this work associated with House Bill 1427, but the ongoing work of learning how the providers adopt the notifications, as well as work with the ACH community, this is really a statewide partnership. So I commend the Hospital Association, WISMA, the Healthcare Authority, and the State Health Department, and all of the ACHs and provider community for coming together to try and figure out a way to use technology that we already had access to in a more in an innovative way and get information back to our primary care physician offices. We started this work in the Olympic Peninsula region last year. We learned a lot there. We wanted to make sure that the technology worked, that the notifications were firing for the prescribing providers that had opted in, and make sure that we had a scalable, stable solution that would work across the entire state of Washington, and we have that. So we're now in a season of working with each of the ACHs. I've met with many of them, as well as Danielle, to bring the information out to the community and encourage your prescribing providers to opt in to this notification. We couldn't do this advocacy and outreach work without the ACH community, so we really appreciate their partnership in this work. This webinar is intended to be informational for all of you, and we will have time to answer any questions. Through the last year of work, though, we have identified many common questions, so we also include some FAQs to help see if that addresses some of your individual questions about what this means to you and your organization. Ultimately, the goal is really to get statewide adoption. So we will work with you, answer your questions, explain how the technology works, and hopefully encourage you to go ahead and get your providers onboarded. The benefit is to support identifying patients at risk of opioid addiction and find out opportunities to select non-opioid treatment options through timely coordination of communication with prescribers, care managers, case managers. This is a real innovative way to connect our emergency rooms with our providers in the outpatient primary care space and see if through technology we can bring awareness to each other and streamline engagement and ultimately improve the overall health of our residents in Washington. Provider participation is fairly straightforward. We've provided some sign-up information to the folks at HealthierHere, and that gives instructions on how to tell Collective Medical that your providers would like to sign up. In addition to letting us know you want to sign up, we have a very simple tool to give us some contact information about each provider and send that in to support@collectivemedical.com, where our support team will go ahead and process those requests and add them to the directory of providers that have opted in. Our support team is also very ready to answer any questions that you have or connect with Danielle and the product team if there are complex questions or issues. So how does it work? The great thing about this initiative associated with House Bill 1427 is that it leverages technology that we already had in place. So the Washington stakeholders came together and identified that Collective Medical was connected to the Washington State PDMP for providing our emergency room providers with information about patients from the PDMP database. And we had a way to move real-time encounters around through the Collective network. So we leverage that. If a patient arrives in an emergency room in Washington and experiences a fatal or non-fatal overdose, and that is documented by the admitting ED provider in the EMR, that information is immediately shared with the Collective network. Collective Medical recognizes that that event has taken place and then looks to the Washington PDMP database to see if there are providers that have prescribed in the last 6 months that have opted in to receive the letter from the state about overdoses. If there is a provider on file in the PDMP and they have opted in to this notification, we will automatically send the letter to the prescribing provider or provider's fax number or preferred method of communication. That's a lot, and I will go over this again a few times as you try to think through how would this impact your provider or providers in your office. If your provider has opted in and one of their patients in the 6 months after prescribing does experience a fatal or non-fatal overdose at a Washington emergency room, they would receive a letter just like this. It has some information at the top about all of the agencies that participate in this effort. It's personalized to the prescribing provider on file in the PDMP. It has some PHI about the individual that experienced a fatal or non-fatal event, the location where the event occurred, and the date. It also includes helpful learning information and resources about managing pain and prescribing opiates to help that provider have some alternatives to think about. And then also a contact information if they have questions that they can contact the Department of Health about this initiative and how the letter occurred. We also hope that the prescribing provider is then better connected with the emergency room that they work with to see if there are ways that they could do better care coordination and care management if the patient were to present at the emergency room again. Overdoses is a pretty broad term. So just to talk a little bit more about how the letters are sent. There are some conditions that have to be met in order for the prescribing provider, the primary care doctor, to receive the notification letter. First, the patient has to be admitted to an emergency room in Washington. Today, House Bill 1427 is a state initiative, and it just relates to emergency rooms in Washington. The admitting provider in the emergency room needs to document an overdose diagnosis. I have provided the actual list of ICD-9 and ICD-10 codes for overdose, and if there are any questions or feedback, the committee that meets once a month is always happy to answer questions about those specific ICD-10 codes. The patient also has to have a discharge date in the encounter. The patient has to have a prescribing physician in the PDMP query, which means there has to be a provider that has reported their prescribing about that patient, and it has to have occurred in the last 6 months. That prescribing provider also has to have opted into this notification. And finally, they have opted in, and so they have also told Collective Medical to add their contact information to our provider directory. As I mentioned, these are the ICD-9 and ICD-10 codes. I'm not going to go through each of them, but also if you have questions or comments, the committee can take those about adding additional ICD-9 or ICD-10 codes or what we noticed in prescribing behavior at the emergency rooms. We often get questions about what kind of metrics we're looking at. So initially, we're looking at number of reported overdose events at the emergency room. We're also looking at number of overdose events that create one of these primary care notifications. The goal of this webinar and the webinar series we've been doing throughout the year is really to encourage more providers to opt in to receive the notification, so there is a better correlation between number of overdose events and providers that have opted in to receive the notification, so we can measure whether the information helps reduce either an individual patient's occurrence of having overdose events or overall across the state, that awareness and connectivity decreases events. We also look at type of reported overdose events occurring. As you saw, there's a list of ICD-9 and ICD-10 codes that trigger the notification. So we also like to look at the different types of overdoses that are being documented in the EMR, and then number of repeat overdose events that also create a notification. As I mentioned, the types of information that we just need to know about the provider in order to add them to our directory is pretty straightforward. We've provided this information to HealthierHere, but it's simple information about the provider: last name, first name, degree, the group, specialty, fax number, telephone number, address, city, state, zip, email, NPI, DEA, and the preferred notification type. I'll talk a little bit more about all of the different types of notifications that we can send. Many of the providers that participate in this do receive them via fax, but we have some alternatives if your organization is using also the Collective platform. What we encourage is for the ACH office to go ahead and after this call, they will send some information out about how your providers can sign up, and then you can send that form back directly to Collective Medical, and we will process the request and add the provider or providers to the directory. This is just another example of how the ACH has taken some information and made it more correlated to your provider, so you can put the name of the ACH on the information sheet. You can take this to meetings and events sponsored by the ACH and help encourage providers in your local community to come on. Collective Medical can also help review any information that you're trying to send out to make sure that it's current for your providers based on what we've learned just in this year of doing the pilot and then moving into expansion. Okay, so that concludes the portion of what is the initiative, how does it work, and how do your providers sign up. I'm going to take a pause here and just ask Tavish, are there any participants that have posted questions in the chat section that I can answer before going into some common frequently asked questions?
Thank you so much, Rachel. We have had a number of questions come in. Yes, some of these may be addressed in your next couple of slides, but I think what we'll do is we'll read them out anyway, and you can decide whether to answer right now, or if you know we're going to come to that, answer it in a slide or two. How does that sound?
That sounds great.
Okay. So the first, and I'm going to read out these questions in the order they came in. So the first question, in order to opt in for this, do we have to already be connected to pre-manage?
That is a great question. It is my first FAQ, and the simple answer is no. Your providers in your office do not need to be connected to collective ambulatory, formerly known as pre-manage, in order to start receiving this notification via fax.
Okay, great. Yeah, the next question, will a provider receive a notification if they prescribe medications other than opioids?
So if the provider reports those medications to the PDMP database and the patient experiences a fatal or non-fatal overdose, then yes. So any class of medication that is reported to the PDMP database.
Okay, great. Thank you. And kind of a similar question, does this include prescribers of buprenorphine, of medication-assisted treatment? Does that go to the PDMP?
I can confirm with the Department of Health, but I do not believe that medically assisted medications for overdose do not get reported to the PDMP.
Okay, so next question. Can dentists receive these notifications, or would they only go to physicians?
Dentists are considered prescribing providers, so I believe the answer is yes if they have opted in and given us their contact information.
Okay, perfect. And we are going to go over how to opt in, correct?
That's correct.
Okay, excellent. Next question. One of our participants had heard that the pilot resulted in a small number of notifications, and she's wondering, what's the number of notifications currently? And has there been any data to support this notification helping to reduce overdoses?
That's a great question. Because we started in a small community in the peninsula, yes, the number of letters that have actually gone out to providers, prescribing providers that have opted in that one community is small. It was something like 14 to 20 in the last few weeks. That is why this type of webinar to encourage more providers to opt in is paramount. We want to see all providers that could opt in join this initiative. The end of letters that have fired and actually gone to a provider is statistically too small at this point to look at statewide outcomes. So we have anecdotal feedback from the chief medical officers and providers that have participated that this is good, but we definitely need to get to a more statistically significant number of providers to correlate with trending ongoing overdose events. The other interesting thing about this initiative is it really requires our emergency rooms to document overdose. And there is variation in practice in documentation of overdose events.
Okay, great, thank you. And some questions are still coming in, so we're going to keep going through them. Is the primary care provider notified, or is it the prescriber of opiates who may not be the PCP?
It is the prescriber.
Okay. And is there a way for the primary care provider to get notifications as well?
We notify the prescriber that has reported the prescription to the PDMP.
Okay.
There are ways that that information could be shared if they have a treatment relationship between the prescriber and the PCP, but the notification is initially sent to the prescribing provider who reported that prescription to the PDMP.
Okay, excellent. Yeah, another question. Could you post a link to the ICD-10 codes that trigger notification? Is that something we could share out after the webinar?
That is a great question. Let me check with Trish at WISHA and Gary at Department of Health and Chris Baumgartner, who manage that list of ICD-9 and ICD-10 codes. And I can share that, Tavish. I can get that to you. I don't think there's any major concerns, but let me just, they manage, the committee members manage that list of approved ICD-9 and ICD-10 codes. But Great question, and I don't think it'll be an issue.
Okay, great. And then our next question, does this only apply to King County providers, or does this apply to other ACH regions if they follow the same process and opt in?
Any provider in the state of Washington that wants to opt into this is welcome. So we actually designed this webinar to be applicable to the entire state of Washington while hosted by HealthierHere, which we sincerely appreciate, but we know there are many folks on the phone from other parts of the state, and we are very excited that you are here, and yes, you can participate.
Okay, excellent. And then, yeah, a couple folks are kind of helping answer some of these questions, so that kind of lingering question around notifications for prescribers of medication-assisted treatment. I'm hearing some folks that MAT medications filled at a pharmacy are reported to the PMP. So that would include Suboxone, buprenorphine. I've also heard from Brad Finegood that methadone is the PDMP. So thank you so much for helping us answer that.
And the other thing I can confirm with the committee is if all classes reported to the PDMP are a part of the overdose notifications. These are very good nuanced questions that we need to get good responses to.
Okay, great. And anything you can share back with HealthierHere, we will push out to everyone who's registered for this webinar today to help close that loop.
Great. Okay, well then I will go through a few of our FAQs, some of which we have already addressed. For example, any provider in Washington can receive these notifications, and you do not have to be currently using the collective platform to participate. A question of how does collective attribute prescribing physicians to the patient with an overdose event? And we follow the PDMP workflow that has already been established for querying the PDMP upon ED admission. Once a patient meets the overdose criteria, collective will pull all prescribing physicians in the last 6 months from the PDMP query, then match those providers to those that have opted into the directory and send the letters. What ways can participating providers receive the notification letters? For providers using the collective platform and have our portal, collective medical supports standard notification destinations like secure mail, staff pool addresses, text, printer, or fax. For participating providers who do not use the collective platform, the notifications can be received via fax. What if a patient has an overdose event, has multiple prescribers returned in the PDMP query? All participating providers identified in the PDMP as having written an opiate prescription in the last 6 months will receive the letter. So multiple letters can be sent based on one patient's individual overdose event. What if a patient has an overdose event that has a prescribing provider not in the PDMP? An overdose letter will not be sent. Will I see the participating provider in the care team section of the portal as prescribing providers? This is not supported as a function of the pilot. It is possible for a provider to be listed in the care team section from other sources, but none of the providers who are part of the pilot will be added to the care team section automatically as part of their participation. So this is specifically a question for those providers that are using the collective platform, and we encourage those providers and care managers to add themselves to the care team section. If you have additional questions about this, please follow up with support@collectivemedical.com and we can help you. What if a patient has an overdose event from an illicit substance like heroin, has a prescribing physician in the PDMP for other prescriptions like benzodiazepine in the last 6 months. An overdose letter will be sent currently. Collective is sending letters on all illicit and non-illicit overdoses for patients with a prescribing physician within the last 6 months. Why is this an opt-in initiative? WSHA and HCA are working incrementally towards statewide provider participation. At this time, it is an opt-in strategy. If you have feedback, thoughts, or questions about that, the committee meets once a month, and we're happy to take that feedback to them. Are participants in the pilot expected to submit client information for all individuals receiving opiates? No. Notifications are sent to prescribing providers who opt in to be notified when their patients experience an overdose event that is diagnosed in the ER. The fact that they had prescribed opiates for the patient is identified by the PDMP. And finally, how is 42 CFR Part 2 resolved in this program if a SUD clinic wants to participate in an overdose notification letters? Again, we follow standard PDMP workflow that has been established with the emergency rooms. If SUD providers give their client a prescription and that client fills it, then it will be reported to the state PDMP registry. And if that provider has participated, they would receive a letter. What will occur if a person experiences an overdose event outside of Washington? Like I mentioned, this is a Washington-based initiative, so we do think it will encourage connectivity and notifications around Washington. But if the event were to take place in Oregon, Idaho, Montana, or elsewhere, a letter would not be sent to the prescribing physician. So as Collective Medical, we want to just thank you, HealthierHere, for standing up this webinar and encouraging learning and discussion around this initiative. We're very appreciative of getting to be a part of it and happy to answer additional questions.
Fantastic. Thank you so much, Rachel. This is, such a great service and helpful information. We have had a few more questions come in. I do want to clarify something. So I misspoke earlier, and so one of our state partners has provided some guidance around methadone and the notifications. So methadone provided by a maintenance program is not reported to the PDMP. That's due to restrictions under 42 CFR. But if methadone is prescribed and filled at the pharmacy, then it is reported to the PMP. Thank you so much, Gary, for that clarification. And now I'm just going to go through a couple of our other questions. So Rachel, in the pilot on the peninsula, there were a small number of notifications. So one of our partners wants to know, was there a quality assurance project to make sure that overdoses weren't missed?
I don't know the answer to that question. However, we could connect you with the Chief Medical Officer for that ACH that sponsored the initial pilot work to get you more specifics on what quality improvement effort this was associated with.
Okay, great. Thank you. Another question, how does Collective Medical obtain the information about the patients who overdose? Do emergency departments need to opt in anyway?
Oh, great question. Emergency rooms are all connected to the Collective network, and we have live real-time admit and discharge connectivity with all hospitals in Washington. If a patient presents and the provider documents overdose in their EMR, Collective Medical receives real-time that notification and the diagnosis. So the providers did not have to additionally opt in to participate in this. It is a part of live connectivity with all of the emergency rooms that's already in place.
Okay, thank you. Yeah, another question. What if the overdose is established by a coroner and not in the emergency room?
At this time, that would be outside of this initiative. This initiative is tied to documentation of the overdose event in the emergency room setting.
Okay, thank you. Yeah, another question. Does registration occur at the individual prescriber level or the agency or org level?
I just need to clarify. You're referring to the registration of the reported medication to the PDMP?
No, I believe this is the opt-in.
Oh, can you please state the question again?
Does the whole organization need to opt in, or can an individual provider who's interested in getting notifications just opt in on behalf of themselves?
The latter. The individual provider can join the notifications, or a group of providers in a common location can opt in. So we opt providers in at the individual level.
Great, thank you. Okay, next question. Can a provider be disciplined for their prescribing practices based on the data you'll be collecting?
I would have to defer answering that question to the healthcare authority and the participants from other state agencies. I'd be happy to give that question to Gary to respond back to the provider or office who's asking.
Great, thank you. Okay, last question. What about hospitals that do not add diagnoses into their pre-managed system? There is no information for ED or inpatient.
So that's a very good question, and that goes back to some of the learnings that we have had about the variation and documentation of overdose events in the EMR. We do our best to work with each hospital to encourage documentation of overdose. But if overdose is not documented in the EMR, then collective is not informed of the overdose event, and therefore a letter will not be sent.
Okay, great. Okay, so it seems that the questions have slowed down a bit. I don't know if we want to give folks another minute or so. Yeah, that's up to you, Rachel.
Not a problem at all.
Okay, and this is Mary. I just want to jump in and say thank you. While we're waiting for folks to maybe chat in their last few questions, thank you to everyone who participated. Your questions have been amazing. Thank you to Rachel for this very informative presentation and great answers to all these great questions. As we mentioned going along, there's some opt-in information that has been sent to HealthierHere that we can send out to the folks on the webinar today. And I know Rachel also is gathering answers to a few of the questions, and we'll be sending out that information as it comes to us as well.
Yeah, and we've also gotten some requests to send out the slides. Rachel, are you okay if we share that with our participants?
I will follow up with you offline with the version of this that I can send.
Okay, excellent, excellent.
And do we have more questions?
You know, we don't, so I think we can give folks some time back.
All right. Well, that wraps it up, and thank you, everyone. We're all, you know, a little closer to our weekend than when we started, and it was great you could join us today.
Thank you, everybody.
Thanks.
Thank you very much.